Hi, everybody. Good afternoon. It's so nice to see all of you here. For those of you who arrived early or on time, you've gotten a reward. I appreciate that. Is anyone who arrived on time and I did not give a ticket? See, I'm not doing my job. Okay. Okay, that makes me feel a little bit better. But remind me when I start moving around, I'll get you one, I'll get you one. There's a couple others I missed. I know people are coming in. Feel free to walk in. So today, I'm presenting on autism, signs, symptoms, and strategies for school-based mental health providers. I designed this presentation to be quite interactive, which is hard with a large group. But there's a lot of hands-on stuff I'm having you do. I'm going to have you participate in a lot of different ways. I want this to be as useful so that on Monday, Monday some of you will have students. You'll be able to take some of these skills and apply them in some capacity. So just in terms of our agenda, each of you should have a handout. It does not include my PowerPoint slides. So I do have a Dropbox that has the PowerPoint slides in it. I'm hoping that Amy forwarded it on to you. There's also a really funky long Dropbox link that I'm about to show you. It's a lot of letters and numbers, and it's probably going to be difficult. So hopefully you'll get that at some point if you want that. I'm happy to email it to you too. My idea is I'm going to go through just introductions and some reflections for you to go through. I'm going to introduce a little bit about autism. Some of you, this is going to be a review. Some of this is going to be new. I think it's important for us to be on the same page in terms of how we define autism and the symptoms and signs. So I'm going to go through that. And then we're going to talk about strategies for addressing behavior problems. My goal is to cover K through 12 in some capacity and some examples. If I don't hit a particular age group, please jump out and tell me. That's my goal. Then we're going to take a 10-minute break. It's about, what did I say? What time? About 2:30. It may or may not be exactly 2:30. I kind of want to see how tired you are. If I feel like I'm losing you, I might do it an early break. But I'll definitely make sure you have a 10-minute break. If you'd like to go to the bathroom, get water, please stand up, go. I'm totally happy with that. And then we're going to wrap up with talking about intervening with severe behavior problems, and I'm going to be introducing social narratives and video models as a way to intervene. So we'll talk about social narratives and video models, and then the last half hour is totally for troubleshooting and consultation, which is an opportunity for you to share real cases with pseudonyms, and hopefully I can provide some ideas, some brainstorming. I won't have all the answers, I'll tell you right now. But hopefully as a group, we can kind of consider what we know as evidence-based practices, what works best for most kids with autism, and kind of brainstorm some strategies. Does that sound good? Okay. Another thing to note, I haven't introduced myself. I'll talk about that in a second. I'm also 6 months pregnant, and I'm realizing just walking like the 3 meters here, I'm like out of breath. So this will be an interesting 3 months, yes, it'll be an interesting 3 months. It'll also be an interesting 3 hours. So I apologize if I'm actually gonna be drinking a lot of water, I might have to step out, I might have to sit down, so bear with me. For those of you who experience this, I'm sure you're empathic a little bit. But as noted, I'm Anissa Goforth. I'm a licensed psychologist. I'm a nationally certified school psychologist. I'm also the director of the United, oh my gosh, I'm out of breath already. Here, let me hold on. Can you see this? Okay. I'm also the director of the University of Montana School Psychology Graduate Program. So I train the school psychology doctoral students who become school psychologists, as well as the specialist level. I also supervise the clinical psychology child-focused. That might be a little dark for me. Just so I can see your faces. There we go. That's perfect. And so I supervise the child clinical psychology graduate students here at UM, and then also the school psychology students. I also work with all the school psychologists in MCPS, all the way up to Arlie, St. Ignatius, Hamilton. So I do a lot of work with the school psychs. And so I have a sense of what their roles are. I've worked with CSCT quite a bit. In fact, a lot of our students do work at CSCT after graduation, either as undergrads or sometimes they start as therapists. So I'm excited to be here. My research actually focuses on culturally responsive practice. So I'm really interested in working with minority youth. But I also have a clinical interest in working with kids with autism. And so I've been doing a lot of research and work with more higher functioning kids with autism, a lot of social skills issues. So my colleague Jennifer Schofer-Clausen, who's in the speech and language program, and I have developed youth engagement through intervention, which is YETI, which is a social skills intervention. Every summer we have a camp. So we've been doing a lot in the community. I'm also involved in the statewide autism program with Doug Doty and OPI. So I've done a lot of consultation with OPI on the needs of Montana, which frankly, we need more. We need a lot more, right? So I'm excited to be here. I will say that I don't know all the answers because we will never know all the answers. And that's frustrating for us who work with kids, right? We want to know the answer immediately when you're in the moment. But I'm hoping today that I can empower you a little bit to actually understand that what the big key is prevention. And preventing the problems in the first place allows us to take a step back and really help the kids who really need it. So before we begin, so this is the funky long. So, okay, good, because I was like looking at this thing, I was emailing it to you, I'm like, this is not something that's gonna be easy. So before we begin, what I wanted to do is talk a little bit about behavior expectations. And the reason I'm doing this is because partly it's to model what we do with the kids in all of our schools, most of our schools that have the Montana Behavior Initiative. And I'll talk a lot more about positive behavior intervention supports later. But I thought it would be helpful, since this is a large group, to share some expectations that you might have or that I might have for us the next 3 hours. So I'm using MBI's be responsible, be respectful, and be safe as our kind of expectations for today. Would anyone like to share maybe an idea of what we should do for being responsible for the next 3 hours? Nice and loud so I can hear you. Yes, be responsible. Okay, so cell phone use. So maybe using a positive way of phrasing that is we keep our cell phones silent or off during the next 3 hours. And we recognize that sometimes we have babysitters at home, emergencies. So if you need to step out with your cell phone, politely wait to start the conversation until you're out the door. Does that sound reasonable? Okay. Any others for being responsible? Yes?
Like you said, if we're sharing some of our experience using the best practices and acronyms, or pseudonyms, or initials, or things like that.
Awesome. So we want to maintain our client confidentiality. So this is a small community. We may or may not try to guess who a particular person is, but let's use pseudonyms, initials, no identifying information, even anything about the parents. I think that's wonderful. So let's maintain confidentiality. Maybe one more for being responsible. Being on time. And I really want to reinforce that, and so I gave you a lottery ticket, and I haven't told you what the lottery ticket is earned. So being on time is important. So after break, also coming back on time, but also if you step out for a little bit, come back. We appreciate you being here. All right, so what about, let's do a hard one, being safe. This is really hard in this context, so if you come up with some good ideas, let me know. What being safe? Yes?
Being aware of the exit sign.
I think that's an excellent one. So an exit sign over there, exit sign over there. You can exit that way. Perhaps another one that I find during all these workshops, I've done this for 450 teachers across the state, when you want to plug in your laptop Try to be careful that it's somewhere where people aren't going to trip, especially pregnant ladies walking in presentations. That would be appreciated. Okay, that's being safe. Okay. All right, so let's wrap up with being respectful. Any ideas or thoughts about ways we can be respectful together in the next 3 hours? Yeah.
Not talking to your neighbor when you were talking.
Okay, so if I'm talking, maybe keeping our mouths quiet. Sometimes we really want to say something though, right? So what would be an appropriate thing, like you want to share, yeah?
Raise your hand.
Raise your hand, that would be a great one. Thank you. So keeping our mouths quiet, inside voices. When we do want to speak, raise our hands. And also, importantly for kids, you wait until the teacher calls on you before, because best thing is, I raised my hand, can I answer now, right? But in this case, thank you, raise your hands. And the others, being respectful. I'd like to share one. So what's important to me is that we have person first language. So it's kids with disabilities, kids with autism rather than autistic. The diagnosis is not a function of their identity. It may be a part of them, but the kid comes first. So I'd appreciate it if you say, this kid with autism, or this child with a disability, child with an IEP, any others that we can be respectful. This will be the last one. Okay. All right, so just to let you know what you win. So at the end of break, I'll pull out probably all 4 prizes. So it'll be at the end of break. So I've got a book. It's called How Rude, The Teen Guide to Good Manners, Proper Behavior, and Not Grossing People Out. Very practitioner-friendly, highly recommended from Doug Doty from OPI. I asked him, I'm like, what's a really good practitioner book? He recommended this one, so that's one you can win. You can win a Montana Huckleberry gummy bears. I mean, clearly, we see these everywhere, so they're needed. Moose poop. And then the other book we have is Understanding and Treating Self-Injurious Behavior in Autism. So another very practitioner-friendly book. So those 2 are for the lottery. But I also brought 4 books up here that you can check out, kind of look over during break, or if we have some time at the end. So if you're interested in kind of getting some, I find these really helpful for social skills in particular, but there's some really good books out there, practitioner friendly. So I'm leaving these out here for you to check out. Please don't take it with you. Those are mine for my practice. But I want to make sure that you have an opportunity to look at that over. Okay. So let's move forward. Okay, so the first thing I'd like to do is to do a little think, pair, share. Okay. So consider the last time you encountered severe behavior problems, or perhaps a power struggle with a child with autism, any age. I want you to think about that. What have been your thoughts related to the situation or the child? So I'm doing a little bit CBT here. What are your thoughts during the encounter with that child with severe behavior problems or during a power struggle? And then the second question, what were your feelings? And how did you cope? Or maybe you didn't cope with those feelings. So take 30 seconds to think about it. You can use the tables, you can turn around, whoever you want to talk to, a pair or 3s are fine. And I'll give you about 2 minutes. All right, wrapping up your conversation. All right. Would anyone be willing to share some thoughts, some feelings they've had during or after a power struggle or when you encountered a kid with severe behavioral problems? Yeah.
Hopelessness.
Feelings of helplessness in a particular way or just generally feeling I can't do anything?
Just feeling like there's nothing that I can do.
Yeah. Mm-hmm. I understand that. Yeah.
I feel like I ended up in a place where I have thoughts about what's going to happen next. This class is going to come in, like staff is going to come in and judge the situation. Like, what's going to happen next? How am I going to stop what's happening right now?
How do you predict what's going to happen? And perhaps a little bit of potential judgment related to that. That maybe, and I'm speaking for myself right here, that perhaps I'm not a good therapist if I can't handle a power struggle immediately. That suggests I'm not good at my job. Yeah. Yeah.
Okay, but in that moment, just the word, "What? Why can't you see this?" And knowing also cognitively that of course they can.
It is on one hand saying, why can't you just stop? And then saying, I understand why you're doing that, and yet just stop. Yeah. Yeah, absolutely. Any other thoughts and feelings? Yeah.
I think for me, confusion, like in trying to get inside the kid's head and figure out why is this one thing so important to you, or what's going on in your head that's creating this behavior.
And then having the complexity of not having them be able to communicate their thoughts or feelings because either they don't have language or they're just simply don't have the insight developmentally to communicate that. Yeah. Yeah.
I think sometimes just keeping other students safe and staff safe.
So making sure that others are safe and staff, including the kid if there's some self-injurious behavior too. And that's a lot. And I'm going to guess that this is an instance when you've experienced this multiple times. Especially there are kids who do this multiple times a day. And then there are other kids who do it multiple times a month. And then there are kids who have severe intensity but less frequent. And others a lot of frequent but less intense. And then there's some kids you know is totally about stimming. And then others is because they're just trying to avoid something. And oh, by the way, you're supposed to know all this and be able to stop immediately, right? And truly, and the reason I want you to reflect a little bit about this is because you're just never going to have all the answers. And even if you become a stellar, expert, world-renowned therapist, you're still not going to have, you're going to encounter that one kid who's going to stump you. And you're going to be like, oh, every tool in my toolbox is now used up and I don't know what to do. That just happens. So I want to also empower you to recognize that you're not supposed to have all the answers. But you are supposed to use your problem-solving skills, the skills that you do have, to try your best and use the tools that you potentially can have out there in the internet world, by the way, excellent, to be able to do what we need to do, which is to help these kids be successful in school and successful in life. So, and by the way, just this month ago, I got slapped, I got punched in the eye, my hair got ripped out, and my arm was completely torn up because I had a kid with autism and yet he just had a major meltdown. And he did that about 3 times a day for 5 days. My poor clinicians, my graduate students, are the ones who are mostly doing it, but I'm trying to support them. So I literally feel your pain, right? But it's not easy, and I'm hoping that I can give you some skills, but this 3-hour workshop, I'll say, is not going to solve everything. But I'm hoping that at least it'll give you some ideas. So we're going to start with Emily. So Emily's kind of a conglomerate of lots of my clients, just for confidentiality purposes and to highlight some things. But she is a 6-year-old girl. She was referred to me for some behavioral problems. She was diagnosed with autism around age 3, and she had met her developmental milestones compared to her older sister, but then hadn't met others, and that's what led to parents kind of wondering, something's going on with Emily. So then she wasn't looking at her parents. She became fixated on wheels. So if any toy cars, the wheels, she became kind of perseverative on any of the wheels spinning. So anytime there's wheels around, she wanted to focus on those wheels. She also had a red Lego in her right hand, or left hand, and her blue Lego in her right hand, and she would spin. And that was her, oftentimes her primary stimming. She would roll it in her fingers like this, and wouldn't stop unless you removed the objects. Now, Emily had some severe disruptive behavior, particularly when you removed the Legos from her hands, and when she wanted to play with her toys, which is toys for her was solo playing in the kind of first grade class, kindergarten classroom, only wanting to play with the wheels and the toys. So for Emily and a lot of kids with autism, the way I think about it is like tartans. We know autism spectrum disorder is it's a spectrum, right? It's no particular child is going to look the same, but they have these patterns that are similar. And we can recognize these patterns and put them together and say, yeah, that looks like autism spectrum. But even if we looked at one pattern of behaviors, one set of interventions won't necessarily support that child in any other capacity compared to another kid, because they'll have such a variety of different symptoms. And it can be described as a developmental disability. It impacts social communication. It impacts symptoms of, I'm going to go into the next one here. We got restricted repetitive interests and patterns of behavior. We have symptoms that present early in developmental periods. So we recognize that there's some traumatic brain injuries that mimic autism spectrum disorder, but those symptoms must occur early in life to be autism. And then it has to be clinically significant. So it has to be impairing. Man, we know a lot of people we work with, they're just quirky. But they're, socially fine. They're just quirky. So that does not necessarily mean that it's leading to a diagnosis. Or perhaps academically successful, so they have an autism diagnosis from a clinician or a physician, psychologist outside of the school setting, but academically fine, socially fine. So they may have ASD but not have an IEP, right? So it's certainly a spectrum of symptoms. And I thought it would be helpful to kind of see some comparisons, because oftentimes we think of autism as the kids we see, and we kind of link to those, and we kind of hold those as our only measures of what autism looks like. So let me see if this will transfer. Okay, so what I'm going to do is I want to show you two videos. I'm going to show you one video. These are young kids. So I know most of us aren't working with the infants, but I thought it would be important because some of the specific symptoms that we might see later on are mimicking some of the early symptoms here. So what I'm going to show is Jimmy at 15 months, and then I'm going to show you Ethan at 17 months.
You got it. Very nice. There you go. Good for you. Bubbles. Let mama open. Give it to mama.
Okay. So we know that social interaction is really a fundamental symptom, right? With lack of social interaction. So for this typically developing kiddo, Jimmy, what do we notice about his behavior? Eye contact immediately, right? I need help. I can't open this bubble thing. Mom, open. What do you mean by processing information?
Give it to mama and he looks towards me like he's taking it out. You just told me something, so I'm gonna, like he's consensual.
So he's able to, he has the language skills. Well, I think most importantly, the clinician pointed.
Right.
Yeah. And he followed the point. Okay? So yes, he is processing. But when I was saying, like, I can't read his mind, how do you know he's processing, right? So yeah, but you got it. Because he needs help. He's like, someone help me. Clinician says, Mom, oh, yeah, Mom can help me. That initiation, that whole little 30 seconds right there is a lot of communication. Yeah.
He also referenced mom just in between bubbles.
He did. So his language skills, he's got the mom, like, one, exactly. Absolutely. So let's compare that, okay?
Uh-oh, only got one. You got it. You got it. There's the bubbles. There's the bubbles. Do you want more? Do you want more bubbles? Ethan. You want lower? Can you give him? Ethan. He says, don't keep rolling him. Maybe somebody will take him.
Can you see?
Can you give him to Mama? Just give him to Mama. Give him to Mama.
Okay. So that's pretty short. What do you notice with Ethan? Yeah.
Lack of emotion,
How do you know?
like when she handed the bubbles, the separate set of bubbles, his face just stayed.
So no affect change, right? So in comparison to Jimmy, there was excitement. Eyes open, mouth open. That affect change suggests surprise, excitement. Ethan, very non-changing, no matter what the situation. What else did you notice? Yeah.
I don't have his history specifically, but it looked like when the bubbles went to him, he just had one recipe for doing something with toys instead of what he just saw the clinician do.
And it's interesting.
Also looks like the adults were used to them being thrown.
Yeah, and they were ready for it, right? And I also wonder, not knowing his history either, I wonder if that's systemic, right? So toss anything that rolls, roll, bring up, roll, bring up. And I wondered if that was what he was focusing on too. So one of the things that we want to pay attention to, and to kind of extrapolate that to,
I have one
oh yeah, go for it.
question about that, is that I think sometimes that when kids, even older kids, they have sort of a recipe of interaction, whether it's social or whether it's an object, and we call it defiance, and yet it's the only card they have in their Rolodex.
Sure.
And
And I think what's important and why I'm trying to highlight Jimmy and Ethan, it's social reciprocity. It's the back and forth of social communication. So let's extrapolate that to a middle school kiddo that you're working with. So what would that look like in a middle school kid? The lack of social reciprocity. Maybe not super high functioning, but verbal. Oh yeah, go. No. Oh, thank you for trying to follow our expected room behaviors. Thank you.
Yeah, just not being able to answer questions so much as like question, so not understanding that give take.
So if I ask a question and ask another question and ask another question, that's what I'm supposed to do. Because I learned when we talk with other people, we ask questions. The next step is we wait for the response, right? And the lack of understanding of that lack of social reciprocity, makes it really difficult because teacher becomes frustrated, right? Now teacher's like, you asked me a question, I need to give you the answer, right? So yeah, that's a great example. Is there another example back here? Okay, similar? Or the friend who wants to talk about Minecraft and okay, that's a really bad example because even typically developing kids are talking about Minecraft. Let's do a different one. Let's do World War II. Like the kid who wants to read and talk about World War II. I want to talk about World War II. Why aren't you interested? They're not even asking why aren't you interested. They're just, I want to talk about World War II. Let me tell you about the details. Let me tell you about everything that I know. It's not understanding the other person might not be interested in World War II. So let's go to another example. So in this one, I'm going to highlight a little bit about social communication deficits as well. And we have Hannah. There we go. All right, so we have Hannah here. All right, so that was Hannah. What did you notice about her social, and particularly her initiation of interactions? Yes?
She did a lot of back and forth, just looking at symbolic way of, this is how she said citizen role. He looks at mom and or caregiver looks back and then like just symbolically like like oh hot dog isn't here and they're like looking and kind of like wanting that engagement. Like are you gonna have breakfast with me? Oh, okay.
Absolutely. There was a lot. So there's a few clues there. We got eye contact. She got the symbolic play, which that's another level to communication, but certainly a very important symptom to know. And then you also mentioned the back and forth. And so there's eye contact, but she also looks down, she looks up, she looks down, she looks up, right? So let's compare that with Ryan here, who's a little younger. So we do recognize there's developmental changes that occur between 3 and 4, but I think this will highlight.
That's right, it looks just like a kid. But I think it's just the top. Is that the top? Ryan, what else do we have in here? What's this? Cup. A cup. Oh, you're right. There are cups in here. There's a plate for you. What is this, Ryan?
It's sandwich.
What kind of sandwich? What is that called? We have those at school? Is that hamburger? What is it when you put this on it? Then what do you call it? When you just show it in the bun? Mmm. That tastes good. Do you want a hot dog?
Clearly no. So what some symptoms are? I'll get you in a second. Let me see if there's anyone else, and maybe in the back, who hasn't talked. Is there anyone who wants to share some things that you noticed from Ryan? Yes. He didn't look at her. Definitely. Yeah, it was not great video, but let me see if I can turn it up for the next one. Thanks for letting me know, though. But yeah, you're right. Even just from observing, he was looking down, and it was more one way, right? She is picking up item, showing item, asking question about item, answering maybe, and then on to the next one, right? There's a lack of reciprocity in that relationship. Now, let's imagine, let's say an 8-year-old, 9-year-old in school. What would that look like, potentially? Yeah.
I think one thing that's when a kid has autism, their lack of reciprocity creates a void that then the adult does all the leading. And so it's really hard to really hold ourselves back to give an opportunity that even remotely replicates that child's initiation. Whereas typical kids initiate and keep it going and they draw us in. And so I guess that's the thing when you have a kid who's older, they might either start like you were saying before about World War II or whatever, and then they just get stuck on it, or they aren't following the plan, the thing you're asking them to do.
Yeah, I completely agree. And that's the way I think about this is at the water cooler when you're with an awkward coworker and you keep asking, hi, how are you doing? How was your weekend? It was fine. Great. Yeah, my weekend was great, right? You kind of jump in the conversation. As adults, we don't like just waiting. And we certainly don't like awkward conversations. As typically developing people, we generally don't like awkwardness. And working with kids with autism is all about awkwardness and being okay with awkwardness and being okay just to sit. Yeah, I noticed I don't know if it's clinician or caregiver, kept peppering questions, right? That's our temptation. And this is, across the board. When we don't know if kids going to respond, we just ask questions, right? Instead of commenting or doing other things that might be a little bit more effective. So thinking about that for peers, right? So peer-to-peer, one kid with autism, and the kid is like trying to engage him, like come play in the recess. Well, it won't take very long for that peer to give up and just leave the kid, right? Because peers, let's say an 8-year-old boy, is going to have a lot less patience than any adult in that school. One try. That's probably the most, and if they're really nice and the mom has been like just be nice to him and, you know, kind of encouraging him maybe twice. So think about that awkwardness as adults and transfer that for peer-to-peer, and all of a sudden that peer relationship hasn't been developed, they haven't learned the social reciprocity, they aren't engaging, they're not initiating, they're not maintaining conversation. So another 8-year-old typically developing is probably going to give up, and they're going to go hang out with a kid who talks back to them, right? Okay, so for the sake of time, we'll do one more. Let's see which one. We'll do restricted patterns of interest here. So initiating your interest. Okay, so these are young kids, so just about a year old. Oh, sorry, I wanted to show this one.
Get smaller. Get smaller. Food. Give it to Mama. That's excitement. That's his excitement. I see that. Is it pretty?
All right, that was pretty classic. What are his repetitive behaviors? Arm flapping, hand flapping, yeah. So we often see kids with these kind of very narrow interests like the World War II, but also the repetitive behavior. So we know that's a really classic. What are some examples of kids that you've worked with? What kind of either restricted interests, repetitive behaviors that you've seen in a school-age kid? Yeah, in the back.
A few years ago, we had kids that liked to count. Every time you'd sit in the hall and stop you and want to touch your fingers and count.
You want to count fingers. That's an interesting one.
It's supposed to be going somewhere else.
Yeah. Huh. I haven't heard that one. That's an interesting one. Yeah.
Pacing and like following lines.
Okay, yeah. So pacing like along walls sometimes, or just generally pacing?
Walls,
Yeah.
you know, cracks in the floor.
Mm-hmm. Mm-hmm. Yeah.
I know someone who kind of crouches low and rocks back and forth.
Mm-hmm.
I suspect a little bit it's about that orientation of their body and really being aware of that.
But they do it quite often?
Yeah, they just like
Okay.
being kind of off kilter.
Yeah, yeah. So clearly, you know, those are more obvious symptoms, right? In terms, and also probably the most disruptive in the sense that other peers would notice, and especially as they get older, then maybe say things like, that's weird. Why do you do that? Just stop. Or frankly, teachers sometimes say that if they're not aware that there's something to do with symptoms too. So, you know, what we've kind of wanted to highlight here, just so we can wrap it up in terms of the symptoms of autism. Let me get back to the PowerPoint. Is that for, and I'm going to give Emily as an example, we've got deficits in social communication and social interaction across multiple contexts. So the reason why I always want to highlight the multiple contexts, I don't know about you, but I interact way differently in a really big party than I do with my family, right? I'm way more awkward probably at the party than I am with my family. But it has to be across multiple contexts, and the social communication deficits have to be impairing. So for Emily, I give an example. I'll go through them and then go Emily. And then we got restricted repetitive patterns of behavior, interests, or activities. So, you know, World War II, we've got hand flapping, we have counting. Those are all examples of those restricted interests or behaviors. This have to be present early, and it has to be impairing. So for Emily, I noticed that she didn't look at her parents' faces, so that was important. Did not respond to others calling her name. I didn't point that out earlier, but when you call out Emily and there's no response, that is also a very classic symptom. Then we've got did not play with peers. So oftentimes either they're solo playing, or perhaps they're playing with peers, or appear to be playing with peers, but it's more parallel play, or even just kind of in the same general vicinity. So her restricted interests, things that spin, the wheels that spin, and then her red and blue Lego. And she very particular with her 2 forefingers. Started early, and then of course it was impairing. So does that kind of capture everything that you are aware of in terms of autism symptoms? Are there any questions so far? Yeah.
I feel like we're going to categorize a lot of these specific symptoms, but still like very emotionally connected with adults.
Yeah, again, that's why I think of the tartan, the patterns. Absolutely. And if they're incredibly high functioning, they can experience, they can label their emotions, they can have empathy, absolutely. And it's not specific to autism, whether or not they do or do not have empathy. How they express empathy might be more or less obvious depending on their level of severity. Yeah.
I was thinking a lot of the kids always get discomfort, and so they get really escalate quickly when things change.
So the routine and breaking routine and transitions, yes, absolutely. So that is often just associated with the restrictive repetitive patterns of behavior. So if you think about repetitive, so when kids are, have stimming, counting, Legos, it's calming, it's control, it's expected, it's predictable. So when there is something that's not predictable, like all of a sudden the substitute teacher comes into the classroom and they didn't know that ahead of time, the whole day is done, right? So that is part of those symptoms. It's the need for routine, the need for structure, the need for maintaining exactly the same thing all the time. And that's also related to like when kids don't like certain clothes. It's discomfort, they want to wear that certain shirt and they wear the same shirt every day. It's the predictability, it's the comfort. So yeah, absolutely. Last question and then we'll move on. Or comment, it could be a comment too. Okay. All right, so with that kind of foundation in place, I want to talk a little bit about what to do with those kind of severe, kind of very distressing situations that you might have encountered. And I'll describe the one where my hair was pulled and everything as a way to kind of frame this conversation. So we do our Yeti camp. And it wasn't recently, but it was a couple years ago. And the kiddo just couldn't transition from one activity to another. And we had used visual schedules, individual visual schedules, we had a group visual schedule, reinforcement, we had used everything in place, but he was just having a bad day. And he ran out of the session room, ripped down every single painting and picture and poster, anything, including the push pins, and grabbed the push pins. Lesson learned. Running down the hallway, ran outside, ran across the street. There were cars around. Came back in eventually, hit my graduate student who was a second year. She had done it before, and so I didn't feel too guilty, but I felt guilty enough. And then decided that he wanted to turn all the taps on in the bathroom, flooded the bathrooms. And that was just within the first hour, right? So in those cases, we had one-on-one clinicians, plus 4 supervisors, plus 2 undergraduate therapists who were supporting them. And we had, so we had 20 kids, one-on-one, but we had dedicated 6 to him. And I laugh because I tell my clinicians, like, you realize you have 6 to 1 right now. You will never have this again, ever. Even if you're in another community-based mental health facility, you're not going to get that kind of. We, fortunately, are training others, and so we can recruit lots of people, right? And we can create, but you don't, I'm guessing, if any of you have 6 to 1, please let me know, because I want to be in that school. No? But what's important here is that even with that, he eventually had to go home. We couldn't solve that problem that day. The next day, we had it all in place, and we prevented the problem from occurring the next day. But that day, we tried everything. We tried everything that we can possibly think of. But it was the next day that we were able to prevent it from happening again. And he definitely struggled. He was having a struggle with transition, but we had enough of a toolbox in place that we prevented it from happening again. And the reason I want to tell you that is because, again, it's prevention. That's the best way to deal with any of the things I'm going to talk about today. So we're going to use an 11-year-old this time. This is Noah. This is where my World War II history came in. So he has a restricted interest in World War II history. He's been able to describe specific events that happened in World War II with great detail. He has had early interventions since he was 3. So he was able to make like fleeting eye contact with adults. He's kind of learned it. It's kind of awkward, but he can do it. And he struggles with initiating and maintaining conversation with peers. He abides by a strict routine. When he arrives at school, he carries his backpack on his right shoulder, unzips the backpack, unloads all the contents onto his desk before he's able to begin the day. During difficult tasks, particularly any academic demanding task, so anything that was hard for him, like mathematics in particular, he became enraged. Throwing objects, chairs, adults, screaming, rocking, crying, the works. This would happen pretty much multiple times a day, okay? Have you ever experienced a kid somewhat similar to Noah? Raise your hand. Oh, yeah. Okay, so we're gonna work through what to do and what things we can consider when we're working with a kid like Noah. First thing I'm going to say is the problem-solving model. This is my friend at any point. Anytime I'm with a client, this is what's going on in my head. I start thinking about, okay, what's the problem? And then I go into thinking about analyzing the problem. Then I identify individual or group goals, so it depends if you're doing an individual therapy or group therapy. Then implement that intervention, evaluate it, and then go back to square one if it didn't work. I'm going to walk you through each of these in detail. So we're going to start with identifying. I think, in my opinion, if you don't identify the problem, you are wasting a ton of time. If you can't identify exactly what the problem is and why the problem is occurring, no matter what intervention, no matter what evidence-based practice you choose, you're going to be potentially wasting tons of your time later on. When I tell my students, and I'm thinking about how do I figure out which technique to use, which strategy, I always think, well, the problem and identifying the problem should link directly with that intervention. So if you can identify the problem areas, then you can identify what's going on and what to do about it. And the first way to think about that is, what are the expectations of that school, of the classroom? And the question is that behavior discrepant from those expectations? Now, this is really important because sometimes what might be referred to you as a problem, maybe you look in the classroom and you're like, all the kids do that. Right? So my favorite thing is in the classroom observations. That's one of the first things I do when I do a psych eval for a kid with autism, or if I do a treatment approach. I look in the classroom, I take observational data, I said, is this behavior discrepant from everyone else in the classroom? I don't know if tantruming necessarily happens with 80% of kids in the classroom, but I will say when a teacher gets frustrated that he keeps, impulsively raising his hand and talking over, but then I find 80% of the other typically developing peers are also doing the same, I can say, let's change the classroom. Let's change the expectations. Let's make sure the expectations are clear for everybody before we necessarily intervene with him. So that would be more a tier 1 intervention rather than a tier 3 intervention, right? So understanding, is Noah discrepant from his peers? Okay, so thinking about screaming, throwing chairs, what else did I say? crying, and rage. Is that discrepant? Probably. I'm just going to guess in most classrooms. So that's a very important thing to know. But going back to thinking, okay, if it is discrepant, what is the expectation? Because Noah needs to know what he's supposed to do, not only what he's not supposed to do, right? So then I love my positive behavior intervention supports, and most of the schools, at least in MCPS, are using the Montana Behavior Initiative. It's really, really handy to have the language already there because it's being reinforced, reinforced, reinforced. So this is a prevention or a framework approach. It's adopting evidence-based behavioral interventions. We also have response to intervention, which is the academic component. So DIBELS and Ames-Webb and those kind of progress monitoring tools are kind of the academic part of multi-tiered systems of support. But really I'm focused here is on PBIS, or Montana Behavior Initiative. And what I love about it is prevention oriented. If we can prevent Noah from getting enraged in the first place, that saves me a lot of stress, right? And allow him to be more successful. So these are just some examples, and the reason I'm bringing these examples in is because we might use them for our intervention. So if we know that Noah's behavior is discrepant, and this is Parker Panther procedures, and in the classroom, these are the expectations in his classroom. Let's pretend. So he has to bring materials, he has to study. The polite is to raise hand and wait to be recognized, say please and thank you. To be productive, stay on task, observe rules, being prompt. Among these, what are some things that you can imagine would be expected for Noah when he's in math class? And I'm using math class specifically because remember, that's where he usually has the tantrums. What do you expect from him in math? Yeah.
You mean what do you expect he's going to do, or what?
What is the classroom expectation for Noah?
What he's supposed to do?
All of these. Yeah. So it's already told to him, right? So this is where I want you to start, and this is where I want to highlight. You're not reinventing the wheel. This is already in place in the classroom, right? It should be. Some classrooms are a little bit more rigorous in terms of applying these than others. But technically, he's learning this. If he's at a school, is be responsible, be respectful, and being safe, they know that's the expectation. So speak in a quiet voice. He is not doing that when he's enraged and tantruming, right? Using time wisely, clearly not doing that. Staying on task, arriving on time, maybe he arrived on time. Raising hands and wait to be recognized, all things that he's expected to do. Here's another example. This is a different school in Montana. But why I want to highlight these again is that these are already in place. So when you begin identifying the problem, your assessment process, you should always do an assessment before you do an intervention, right? You need to collect data and know what's going on. You have to understand the problem before you intervene. So what I would typically do is I'd look at his previous IEPs. How many tantrums has he done? Has this been going on recently? Is this a teacher that he just particularly has struggles with in math class, or did this happen last year in math class too? I want to look at psych reports, medical reports, and maybe you've already done all this, right? Because you might be on your caseload. That's okay, but reviewing it can be helpful. Then I might do an interview with a teacher. That might be the first thing I do. Be like, hey, it sounds like you're really frustrated. So he's tantruming a lot. Can you tell me a little bit what happens right before, what happens after? How do you feel about this situation? Do you have any ideas? Sitting with the teacher, listening to the teacher, making the teacher feel heard, because guarantee that teacher is feeling very frustrated, right? Listening to their ideas, and they might just vent at you, right? They might just tell you all the horrible things that Noah's been doing, and you're gonna listen, you're gonna nod and say, yeah, you're feeling frustrated. Let's come up with some solutions so that you don't feel as frustrated with Noah. I might do an interview with parents because I wonder if they have strategies at home that could be really useful in this case. And importantly, what I love is my observations. And I don't just observe him in math class, but I want to observe him in reading too. Because if he's not tantruming in reading, what is different about that teacher, that setting, what's going on? And I always think of therapy as being a detective. What is different about one situation versus another that I can learn from and understand better so that I can figure out why Noah's behaving the way he is? Does that make sense? I have lots of observation tools. I have my email at the end. I have tons of ways that you can do observations that's systematic as well as naturalistic. I'm happy to go into that. We don't have enough time to kind of go into how to do a full, very concrete observation. But I find these very helpful because not only for data collection, so I can progress monitor across time if my intervention is working, but also, is it discrepant from a peer? Because if there's 5 other kids also tantruming, okay, well, there might be something about the context, not just about Noah, right? So we've got Noah here. Okay, so what we know so far, I'm going to make up some data for you, just in terms of our assessment process. You did an observation. You noticed that definitely math class, very discrepant from peers, becoming enraged, particularly when the math task requires independent seat work, and it's a worksheet, and it's too hard for him. You know it's too hard for him just based on his previous history. Teacher also says, I'm really frustrated. I've tried everything. I've given him like half of the worksheet to do, every other question, I've given him rewards. I'm just feeling so overwhelmed and frustrated. I just have to have you come in and help me. The parent says, yeah, math, he tantrums at home with math. Any math homework, we're done. We just give up. It's not worth our time. We'd rather like spend time on reading, really spend quality time with our son when he's at home and not just get into tantrums. We just don't even go there. Previous IEPs and psych reports say this hasn't been an issue in the past. He's had tantrums as a kid, but this is particularly, doesn't seem anything odd in terms of math particularly. Okay, so we're gathering all this information about Noah, figuring out, okay, what's going on here? And now we're starting to develop some hypotheses, right? Okay, math clearly is something hard, but is reading hard for him? Because if reading is hard for him, you'd expect the same tantrums, right? If it's about demand. It isn't as hard for him. So, okay, maybe it's math particularly, it's a little over demanding, and he doesn't like it. Okay, so then we have to define the problem, and we have to make it observable and measurable, right? So we always have the stranger test. This is if I walked into your session and you were sick and you left and I replaced you, would I know exactly what you're doing? Would I know how you're intervening, what the problem is? Would I be able to exactly observe Noah the way you've observed? And to me, that's the key, because if I can describe Noah's behavior very concretely, then I can track his progress. I can see whether or not my intervention is actually effective for him. I can figure out if what I'm doing is working. So we might think about some target behavior. So here's some examples of target behaviors. And this might be familiar to you, but I think it's well worth covering because this is how you can prevent the problem from happening in the first place. So Kim does not do what the teacher asks. Or Andy's hyperactive. Fred does not ride the school bus properly. So those are very common referrals from teachers when they're concerned about a particular kid's behavior. Have you seen similar things? Sure. So what I might then do is being more specific and observable. I would say, when given a direction by the teacher, Kim fails to initiate the behavior within 5 seconds. That is much more observable because I can see Kim initiating a particular behavior, whether it's starting a worksheet, starting the assignment, whatever it is. And I can time it and I can see 5 seconds, okay. And then I say, well, the other question is 5 seconds normal or typical? Would you expect a peer 5 seconds? Perhaps, but the best way to know is if I can compare it to a peer, right? If most peers are starting at 20 seconds, I'm like, this is way too high of an expectation. But if everyone else is doing in 1 second, then I'm like, give him a little bit of wiggle room. Or I might think of Andy's out of his seat more than one time in 10 minutes. pure frequency count. How can I know that Andy is sitting? And it says, remember Andy's hyperactive. What does hyperactive look like? Well, it looks very different depending on which kid you're talking about. So right now we're just focusing on sitting in the seat for more than 10 minutes. Or not getting up out of a seat more than once in 10 minutes. And then we have Fred as an assigned seat on the bus. So specific, it's measurable, it's observable, and it passes the stranger test. So if I can jump into your session without knowing anything about the kid, I would know, okay, Kim's goal is to, she needs to initiate the behavior within 5 seconds. Make sense? Questions? So Noah, let's say the teacher comes to you and says, Noah tantrums frequently in the classroom when he doesn't want to work. Okay, that's the kind of initial, the typical teacher response. Like, he just doesn't want to work, so he's tantruming. So what questions might you have about being observable and measurable about this statement?
Morning, afternoon, specific subjects.
Okay, when? Why? Okay, so let's start with when. You said subjects, contexts, and you said something else.
Yeah, time of day.
Time of day. Okay, and then I heard a why somewhere. Tell me about what you mean by why.
Therapists, there's got to be some sort of method, that gets them all riled up.
What do you mean by method?
Like you said, trigger.
What do you mean by trigger?
Like you say that he's, like ill to math.
Uh-huh.
Why?
She doesn't say math.
Or,
Yeah, I hear what you're
You
saying.
know,
So trigger, okay. Tell me what trigger is.
I guess like when I was working with kids
Uh-huh.
in the group home, and there was something that set them off.
Something that sets them off.
Yeah.
Okay.
It's not even like it could be a frequency.
Okay.
Or like everyone in the room. Or
Okay.
too much stuff going on. They
So
don't-
the context so the context of the situation might lead to a certain behavior.
Right.
Okay. Okay, I think I'm understanding a little bit more.
Like we had a kid that wanted to be, he really wanted to be cool. So if you made him look bad in any way,
Mm-hmm.
he'd lose it.
Okay. So in that case, the context is peers
Right.
and shaming around peers. Okay? Thank you.
Just wanting to know what the function
Okay.
I mean, is it really because he wants to avoid the work, or is he hungry?
So what's the function of the behavior? Yes, and we're going to go right away into that too. So awesome, which is related to somewhat to context. Let me get you here and I'll get you there. Yeah.
What led up to, like, was it much time prior to this?
So what's going on right before? What happened right before? Who was there right before? And I loved your comment about peers. What peers were there? Were adults there? Who was there? What was going on? Yeah.
I think defining tantrum is essential because if the teacher is saying that the tantrum is more this end result, then we're missing when it starts. And and then that also gives us information about the trigger and about all that. So
Love it.
I think you need tantrum.
That's where you begin.
Tantrum is not a word to everyone.
So what I think, and I'm hearing everybody, and this is awesome, but I think the first thing you need to find out is what does she mean by tantrum? Because what I define as tantrum is going to be way different than someone else with a tantrum. A mom with a 3-year-old who's a therapist might see tantrums way different than another teacher. Your tantrum is different from my tantrum. So one of the first things that I would ask is, tell me about the tantrums. And my favorite way of doing this is I say, play me a video. Describe a video to me. And then I've said that to teachers, and they're like, actually, I have one. I had to do it because I was like, I didn't know what to do. Or a parent would say that too, like, oh, I videotaped I love that because thank you. You don't have to describe it to me. But then I want to know, is that tantrum common? So is the tantrum they're describing in that moment, is that different from yesterday or last week? Right? Because again, tantrum changes. Is it screaming? Is it hitting? Is it throwing things? Is it all of the above? And I think that's an important, very important piece. So, And what I'll do is I'll just wrap up this about operational definitions, and let's take a break, because I think people are feeling antsy, might need to go to the bathroom. So let's just do another 5 minutes, just so if you're thinking, I might be needing to go soon. So what we're talking about is operationalizing behaviors, right? So when I have to define the tantrum, I'm operationalizing a behavior. I'm describing it to such a specificity that I know and you know exactly what we're talking about. So I might say, crying is defined as the occurrence of vocalization, sounds or words, accompanied by facial contraction with or without tears for any period of time. Because I will say, I have seen kids without tears, tantrum, and crying, kids with tears, kids with red faces, not with red faces, also different ways. But here we're talking about occurrence of vocalization in particular with facial contraction, with or without tears. Or lying on the floor when doing so is not part of the class activity. That piece is important, because guess what? In first grade, lying on the floor during reading time, totally appropriate. Not considered tantruming. But she's lying on the floor. Okay, when, how? So that operationalization is, again, key to identifying the problem. If you can figure out what the problem is, you can figure out why the problem is occurring. Here's another. So this is the one we're going to use. 2 or more instances of a co-occurring behaviors in which Noah is crying, with or without tears, throwing items, flopping body onto ground, or stomping on ground with his feet after an academic demand for a duration of 10 seconds. So if he says, I don't want to do math, would that be a tantrum? No, it has to last 10 seconds. That's important, because that is actually not bad, right? Actually, but like, that's an improvement from the tantrums before. So I have to give specificity in how long it's going to occur, so I know if the tantrum's actually reduced. Also, it can be 2 or more instances of co-occurring behavior. So 2 behaviors could occur together. And that's important, because he might just cry because his friend took whatever his favorite toy away. Is that a tantrum? No, if you're defining it this particular way. So operational definition allows us to understand what it is that we're all talking about. Now, we spend a lot of time. Sometimes this can be a week-long process of finding this out. Sometimes it could take 2 weeks. Sometimes it can just take a day. Like if you just do this really quickly and you know the kid, it's been on your caseload for a while and you're like, okay. So it depends. The assessment process is important though, because when we get to the next level of analyzing the problem, it's going to be so much easier, and all this time you spend on the assessment is going to help your intervention and therapy so much better. Okay? So it is 2:12. So how about at 2:20? Is that 10 minutes? Yeah. No, that's 5 minutes. 2:25. Let's all come back together. I will have another round of lottery tickets for those of you who come back right at 2:25, and I will have those prizes. All right, thank you. And I just want to reflect a little bit of what I'm doing, because I am modeling one of the biggest strategies that I find so effective, is a positive reinforcement system. I'm not going to go into it so much. We're talking about social narratives and video modeling today, but this works pretty much with every population, including mental health professionals who are eager to win a moose poop candy as well as How Rude book, right? But you all sat down and you got here, and then when I forgot, you made sure I remembered, right? So one of the things I find most effective for preventing struggles is that once an intervention is developed, and we'll talk about that in just for the rest of the session, is integrate a positive reinforcement system for all those expected behaviors that I would like to see. Normally, if this was a smaller group, I would have been rewarding all this participation, like the raising hands. I usually do a workshop that's like 6 hours long, but with 2 people, and we can do that when there's 2 people. With me, I just know I couldn't do it. So I wanted to reinforce participation, and I really appreciate those of you who raised their hands, and encourage those who have not yet, and you would like to share something, please do. That really engages us. But also about positive reinforcement, did you notice that I was very specific in my praise? I said, thank you for being on time. I appreciate you being here. Thank you for coming, right? So I was very specific to why I was giving you the lottery ticket. It wasn't just haphazardly giving it to you. Hopefully all of you knew exactly what I was reinforcing you for. And what I might do in a group, social skills group, or I might do for Noah eventually, is have this positive reinforcement system and the reward be something that's highly desirable. Now I think I gave you the example of Emily. You know what her positive reinforcement was? Getting her Legos back. That was it. She earned tickets to play with her red and blue yellow Lego, and she got to spin it, and we had a timer, and she could do it for 2 minutes. That was it. So it doesn't have to be a fancy, books, off Amazon. Oftentimes, it's what they really want. Reading World War II books together, right? Things that are highly desirable for that and individualized for that student. And I use this for our camp. It allows everybody to know what expected behaviors are. I give it frequently in the beginning, and then I make it much more difficult towards the end. So I might start with 5 tickets, and then it goes up to 100 by the end of the week. But just think about how effective it was for you, and it's probably going to be effective for most kids too. So on that note, we'll start from low to high. I'm figuring the moose poop is the least desirable item. So let's see. Get your tickets out. So 8927013. There you go. Thank you for playing, everybody. You can still maintain your expected behaviors for the rest of this session too, though. And if you haven't had a chance, I'll keep these books out here, but I did want to highlight what I had. We got social skill activities for special children, 160 ready-to-use lessons and worksheets. This is a good book for getting activity ideas. These are mostly social skills. Promoting social success, a curriculum for children with special needs. And then we've got Carol Gray's book, which you might be most familiar because that does tend to be used mostly in schools, the New Social Story book. And then A Quest for Social Skills for students with autism and Asperger's, ready-to-use lessons with games, role play activities, and more. So I know a lot of you like to use manualized interventions. When I talk about social narratives a little bit later, I'll talk a little bit about individualizing those social narratives to make it more specific for your client. So let's just review a little bit what we've been talking about. So I started talking about the problem-solving model, how important it is. We had Noah, who has really kind of significant tantrums, which we defined very specifically with observable and measurable, an operationalized definition. Because we know the problem, now we can analyze the problem a little bit more. Now it's about the why. So notice, some of you wanted to jump to why right from the beginning. Well, why is he having it? You can't understand why unless you know what it is. So before you even jump to why, and talking about the functions of behavior, think about what it is not, and what it is. So remember we have Noah here. And one of the first ways to think about analyzing the problem is why, is a functional behavior assessment. I can't get into this, it would take like a 3-hour workshop just to talk about FBAs. And I have lots of colleagues who are experts in this a lot more than I am. I love FBAs. But I wanted to make sure I talked about it because if you've been trained in it, and know how to do it well, it is really, really helpful. So I'm going to do a little introduction to it. So it's a process. It's an assessment is a process, it's not a test. It's a process that identifies a specific target behavior, the purpose of the behavior, and factors that maintain the behavior that is interfering with a student's educational progress. So we talked about the specific target behavior already, and part of that FBA is also this whole problem-solving process, so that's why it's overlapping. But really, what I'm really geared here, the analyzing the problem, is the function. So this might be a refresher, but let's make sure we're all on the same page. When I talk about behavior, usually it's a problem behavior. We're talking about antecedents and consequences. So we're talking about the ABCs of behavior. Sometimes we refer functional behavior assessments that way, the ABCs. We're considering the antecedent, which are the conditions under which a problem behavior is likely to occur. And then we're also talking about the consequence, the event that maintains the problem behavior. So let's just begin with the antecedent. Let's think of Noah. What do we know so far about the antecedent, the conditions in which his behavior occurs? Math, we know the context, specific subject. What else do we know? Yeah. Working independently, excellent. Yeah. A worksheets, so worksheets particularly are, yeah. What else? Do we remember? I think those are the big ones. So important ones, right? We know when it does not happen, reading. Probably doesn't happen in recess, we don't know, but let's assume our observations show that. And particularly demanding math, right? So easy math may not trigger, using that word, lead to that behavior, but we know that math that is demanding is. So it has to be a certain level. Okay, so the other question is, what is the consequence? So the consequence is what's maintaining that behavior. So we can see behavior keep going. The frequency of the behavior maintains for a reason. As humans, we like to seek pleasure and avoid pain, generally speaking. We will do things that will get us something, typically, and avoid things that we don't like. And we'll talk more about function in a second. But the consequence maintains that, and usually it's something that's occurring in the classroom that is oftentimes not the kid himself. So it could be the teacher's behavior, the peer's behavior, something occurring in the context of the classroom, but something that's going on after the behavior. So typically, I'll go through this in just a sec. Oh. There we go. So we have to describe the specific behavior. So with Noah, we already know, right, what the tantrum is defined as. We identify the variables impacting that behavior, the antecedents and consequences. And literally, the first thing I do when I talk to a teacher in an interview, I write out antecedent, behavior, and consequence. And as soon as the teacher starts talking, I write under which line it goes under. Is she talking about the consequence or is she talking about the antecedent? And that's where my notes go. Then I identify the function of the behavior, which I'll go into in a second. And then I develop a best guess hypothesis. This is something we often forget. We are practitioner scientists. We are constantly seeking clues and trying to find out what is going on that's leading to a particular behavior. But we may not have specifically 100% knowing exactly what it is at all times. We constantly have hypotheses, and we test those hypotheses. So we have to kind of think about, based on what we know, what's the best guess? What is going on with Noah? So I know that Noah is struggling in math, particularly demanding tasks and independent seat work during worksheet time. I know that particularly the math has to be demanding, so his frustrational level is already high because it's demanding. The behavior is tantrum, which is defined as, oh, now I'm not going to memorize it, two co-occurring behaviors that include something, something, and I don't remember the rest of it. Yeah. So it's very specific. The consequence, we're not entirely sure, but we could probably guess in a second. And then we can understand the function. So let's talk about the function. So when we're analyzing, it's really 4 functions. Any behavior, any kid's behavior, and frankly, adult behavior, including typically developing adults, there's 4 functions. We want to escape something we don't like from a person, a task, an environment. We might desire something like a specific item or an activity. We might seek attention. And I want to be clear, when I say attention, it doesn't mean necessarily positive attention. It could also be negative attention from peers or adults. And could be sensory. So sensory behavior feels good or meets a sensory need. So if we know those are 4, wow, doesn't that narrow down this process so much faster? So let's think about, start from the bottom, sensory. Noah, math. Is this fulfilling a sensory need for him? Not that I can tell. right? The tantruming, I mean, I'm thinking, okay, well, does lying on the floor, does a carpet feel nice and soft? You know, I want to think about, okay, is there anything sensory that he's getting from the tantruming? I can't think of anything. So probably our hypothesis that is not the function. We've got desire for attention. Do we think that Noah might be getting attention from his tantrums? Potentially, yeah. That'd be a hypothesis. It's like, well, I'm going to guess that the adults are paying attention to him in some capacity, whether negative or positive. Peers are probably attending to him. That's where a good observation is really helpful during the tantrum. So that's a potential hypothesis. Tangible, desire for a specific item or activity. Based on what we know, does he get something, like a specific item from his behavior? Not really, so that can be kind of knocked out. Now escape from a person, task, or environment. And now I'm not seeing a lot more nods, so if we had to be detectives here and we're like, okay, we don't know for sure that tension is the reason, but more likely escape. So now we have two potential functions. So already you've narrowed it down. I'm going to skip that one just for time purposes, but I'm going to go into some just examples to help us kind of clarify. So Mr. Feeble asks Rolf to take out his math book. Rolf responds, your mother wears combat boots. Mr. Feeble then sends Rolf to sit in the hall instead of doing math. What is the hypothesized function of Rolf's behavior? Guesses? A? C? Could be. So this is where escape and attention, excuse me, can be actually kind of complicated. Teasing out escaping a situation and maintaining attention from an adult or a peer can be overlapping. In this case, my guess is because the immediate behavior that he gets is sent to a hall, it's most likely escape. But if Mr. Feeble says, Rolf, that is inappropriate. Why are you talking about combat? That's ridiculous. Yeah. What, I'm sorry?
If all the kids laugh.
Yes, exactly. If all the kids laughed and thought it was funny, that could be a peer attention. Absolutely. But given what we know, it's probably escape. So, or avoiding, right? Sally sits next to Simon. Simon sticks his pencils up his nose and makes animal noises only when Sally sits beside him. Sally giggles. What is the hypothesized function of, I don't know why it says Simon there, it should be Sally behavior. Okay. B. So, let's do a final one together for FBA. When Sequoia comes in late to school and the teacher asks her to go to Centers and begins projects, she makes negative statements about herself, she scribbles on papers, and wads them up. Staff put her on the timeout chair and write up discipline form for being disrespectful. So, first thing we want to start with is we want to think about the behavior, right? So remember the problem-solving model. First thing is identifying the problem. Well, Sequoia makes negative statements, scribbles on her paper, and wads them up. We've got the specific behavior down. We've got concrete, very specific. Well, thinking about the antecedent, what happens right before, teachers ask her to go to Centers and begin projects. That's what happens right before the behavior. The setting event, so sometimes when we think of the ABCs, is what happens, the context is setting to the antecedent. She comes in late. So the consequence is teacher sends Sequoia to time out for being disrespectful. So what's your hypothesized function of Sequoia's behavior? Doesn't matter. Yeah.
Well, my first thought is she's coming in late to school, and that it's this pattern of her doing these things. And I personally think it's for her to reinforce her own sense of, nobody likes me. And so it's attention. Basically, it's attention, but it's a weird.
Okay, I see what you're saying. You're going way, way, way too deep. And not because this is what we do, right? We're mental health professionals. We go deep.
I guess I don't feel that way, actually. I think it's Pretty simple, because she could come in and a teacher could put her arm around her and say, hey, sweetie, let's get started. And that might end the whole thing.
True. We only know this,
Yeah.
right? So one of the challenges is we sometimes make things a lot more complex. And I actually kind of agree. There could be a lot of reasons for her. But what I really want you to focus on is the behavior, not the reason for the context of why she came in late. All we're focusing is on her behavior. Her behavior is that she's coming in late, says negative statements, scribbles her papers, and wads them up. Okay? So there's all sorts of backstory. We could have a family history. There could be trauma, right? There's all sorts of stuff. But when it comes to really like looking at particularly severe behavior, sometimes we just have to look at the behavior and not go into the whole detail. But before we can go into the whole detail, we need to know how to address that behavior. So what are some hypotheses? And you mentioned attention. So that would be the hypothesis. The function of the behavior is attention. What would be a potential another one?
Sounds kind of like she's sort of initiating a break for herself.
So what's the function? Avoidance. So you can think, so I like that you're approaching like initiating like a break, she wants to get away. There's reasons for her avoidance, but that's not what we're looking for. We're looking for the function. What is going on? What is leading to the behavior change? Because if she has self-esteem issues, if she has family history, if she tries to initiate a break, that's all great. But when we try to analyze a problem, being very specific and clean can be really helpful for us. Because a lot of the kids that we're seeing, there's multiple functions sometimes of different behaviors, right? There's a ton of different behaviors and each one has a different function. But we need to know and focus on one specific behavior so that we don't get overwhelmed. And so sometimes simple is okay. And in this case, it's probably avoidance. So she can avoid tasks, escape. Okay. So just to kind of summarize here, we now need to have a hypothesis statement. When this occurs, you're describing the circumstances, the student does X, Y, and Z to get or avoid, describe the consequences. This one sometimes changes when we work with kids with autism. It might also be to obtain sensory items, something like that, or to get have stimming opportunities. That tends to happen a little bit more with kids with autism than necessarily a kid with anxiety or a kid with conduct disorder. But generally, you want to create a hypothesis statement. So we know now the function of Noah's behaviors, escape or avoidance of an unpleasant experience, i.e. a demanding math class. Okay, that took a long time identifying the problem, the function of the problem. But guess what? Now that we know that's escape, we know what to do and perhaps some ideas and next steps. So here, we're going to talk about developing some individual goals. So if you know what the problem is, you can now develop a goal, because treatment should always have a goal. We should always know where we're going as therapists, no matter what type of treatment that we're providing. So during a 15-minute observation during math class, Noah will keep his hands, feet, and objects to himself. That could be as specific as that. Remember, the focus is tantrums. Did I say Noah will not have tantrums? Or I could also say Noah will reduce the frequency of tantrums as defined by, and then the whole definition. There's a few different ways you can do it. But ultimately, we're trying to decrease the tantrums, but also increase keeping his hands and objects and feet to himself. And guess what? This sounds like an awful lot like PBIS or MBI. Sometimes classrooms have keep your hands and objects to yourself. It's a positive frame of not screaming and throwing things, of kicking somebody, right? Does that make sense? Do you see how I got there to where we are now? Okay, because that'll be important as we move forward in talking about evidence-based practices. And specifically, I want to highlight in your handout, there is my favorite website and my favorite resource, and I use this all the time. It's the National, I wonder if I have a handout. Is there someone with a handout? I can tell you the exact one. So on the second page, it's the first website, National Professional Development Center on Autism Spectrum Disorders. There's a website. It tells you exactly all the evidence-based practices that are out there for kids with autism. It has descriptions of how to do each one, step by step. It has an observation form for you to use for that particular tool. It has the research all listed there. It is awesome because sometimes we just need a really handy resource. These are some that are up there. So we have lots of different evidence-based practices. So differential reinforcement, we have peer-mediated instruction, social skills groups, visual supports, redirection, video modeling. Lots of different ones out there. Clearly, I can't cover everything. So what I thought would be best is I would cover kind of 2 critical ones that I've used in my practice and have taught my students and found the most effective. And the purpose of video modeling and social narratives, so social narratives is the generic term for social stories. I personally do not use Carol Ray's work because I feel they're too generic. They're not individualized for the kids that we serve. So social narratives is essentially the same thing. And then video modeling. And this we have used specifically for reduction of tantrums and severe disruptive behavior. So I'm going to show you how to use each of these. We're going to do lots of hands-on stuff. Get ready to get up. Just letting you know. Okay, so the first thing we're going to talk about is social narratives. A lot of research out there. I'm not going to bore you with all the details of that, but I will say if the social narrative is written well, this is the kind of key part here, if it's written well and as designed, it has huge improvements observed in kids with autism. Lots of research studies have shown this support, and it can be really, really helpful no matter what level of verbal communication they're at. So if they're low verbal, you can use simple, concrete words, but you can also use pictures, okay? So there's modifications you can use there. You can seek attention, so some of the reasons why you might use social narratives: seeking attention, initiating comments, initiating requests. Part of figuring out why Noah is tantruming, so that we know if it's attention or escape, we now can have a social narrative that addresses what he wants. So social narratives, and I think on your 4th page in your handouts, I have little hint tips in there too. You want to start with a descriptive sentence. This is where you objectively define anticipated events where a situation occurs, who is involved, what they are doing, and why. So, for example, inside the school, people walk. What am I assuming you're not supposed to do? Run, jump, I guess. But essentially, inside school, we walk, okay? Context, very simple. This is what we do. It's descriptive. Then you include a perspective sentence, and this describes the internal status of the person or persons involved, their thoughts, feelings, or moods. So, for example, people feel safe in the school when everyone is walking. So a perspective of people around the kid about why potentially it's important to walk inside the school. And then you conclude with a directive sentence. And this is individualized statements of desired responses stated in a positive manner. And that positive manner is the important piece here. So you may say, they may begin with, I can try, or I will work on, but try to avoid sentences starting with do not or definitive statements. I will try to walk inside. So that's what you want kiddo to do. So you start with descriptive, perspective, and then directive. And so here are some examples. Oh, here's a little bit more description too. So generally speaking, you want 3 to 5, you want it short. What I've seen, like novels full of social narratives, like the whole social narrative is like a book. Unless it's like multiple social narratives in the book, that's way too long. You want simple 3 to 5 sentences. And you want one perspective to every directive sentence. Sometimes I'm a little bit casual on this, but you're supposed to. Write in the first person and on the child's developmental skill level. And then use pictures that fit with the child's developmental skill level to supplement the text. So sometimes that picture can be really helpful in kind of prompting, remember, this is the social narrative. This is what we talked about. So here's a vignette. We're going to walk through this. So Bobby is 9 years old, who's diagnosed with ASD. His teacher comments how he's always sent to the bathroom to clean his face and hands after lunch because his face is dirty after eating. Furthermore, Bobby has been sent to the principal's office for not using a safe body in line. Lastly, Bobby's parents are concerned that he doesn't have any friends because they observe him sitting by himself, not speaking to anybody. That's a lot of things going on for Bobby, right? So one of the temptations is like, we're just going to do a social narrative for everything. But that's a lot for Bobby, and it's a lot for us. So instead, we might just focus on a couple different pieces that's going on for Bobby. So here's just an example. Let's focus on his dirty face. So I might say, when I eat, I use a napkin. I use the napkin to wipe food from my face and hands. When I am finished eating, I use my napkin one last time to be sure my face and hands are clean. I am careful not to wipe my hands and face on my shirt. When I use my napkin, I keep my face and hands clean, and then I don't get other people and toys dirty. Everyone likes when I use my napkin. So we have descriptive sentences, we have perspective sentences, and then we have directive sentences. The whole purpose is to teach Bobby a social skill, something that he struggles with, keeping his face nice and clean. It's pretty gross. I use this a lot, by the way, with nose picking. It's so gross, right? Like, and honestly, with typically developing kids too, like, no, let's review, and we'll do. I use the social narrative because it's helpful. Because why is nose picking dirty? Did you know you all nose pick? But you nose pick on certain times, right? You do it privately. You do it with a Kleenex. That you just don't do in front of people. But did you know that these kids can't learn that unless you tell them that, right? So that's what is so important about social narratives, is that these are social cues that we take for granted. We forget that we learn this naturally. For a lot of kids with autism, they need to be taught in concretely. For the same reason, if I decided to come talk to you over here, and I just got, hi. Oh, she moved her, what? You moved your body away. Why did you feel uncomfortable?
Just my personal space,
So is this too much? Is this too much? Is this too, depends who, exactly, depends who I am. So did someone teach you that? Did your mom say? So when you're with your mom, you're supposed to be 3 inches, you can kiss, but when you're with your teacher, you're supposed to be 1 foot plus 2 to 3 inches. But then only if your teacher's the first year, like if you just met your teacher, it's like different than if you've known for a whole year. Oh, and by the way, you're supposed to know all of that, right? And by the way, your neurological functioning is not allowing you to learn that. So our expectations and our social narratives allow us to concretely describe what we want and our social cues and expectations for these kids. And you giggle and you laugh and you're like, oh yeah, this is really hard. This is why, by the way, I like autism, because I study culture. This is culture, right? Space. Context matters. If I'm in Asia versus Latin America versus the United States, right? So social narratives, this is why I find them so helpful. For kids like Noah, who has severe problems, severe disruptive behaviors, but also kids who just need a little bit of nose-picking teaching, right? Or adults. Maybe you can use this in staff meetings. You never know. Here's another one. And just notice, I also had pictures, so that was the other thing you're supposed to include. Sometimes I want to talk to people. The best way to start a conversation is to ask a question. Sometimes I ask, what are you doing? Sometimes I ask, how are you doing? Sometimes I ask about things I know about them, like, how are your pets? Or, are you feeling better? Asking questions is a good way to start a conversation. How did you know you start a conversation? Your water cooler talk? By the way, when I teach adolescents, like high school kids, I love social narratives, particularly for flirting. Like, oh my gosh, is it hard for adults and like adolescents to learn flirting? And then this kid, he was so sweet. He wanted to flirt. He's like, had this girl, he liked this girl, and he's like, and he said, like, I just want to know, like, how do I, like, I saw other boys do it, I just wanted to know. It was awesome. And I was like, I suck at flirting. I don't know. And then like, you're like, well, and then trying to think about how to describe flirting to somebody, right? Like it's so nuanced. Oh. Another good resource is, let me think about it. It's a social network for kids with what used to be called Asperger's. Wrongplanet.net. I think that's what it is. Either .net or .com. They have tons of video models of how to flirt, how to date, like what to do on a date. It's awesome. And they share with each other, like, oh, this is what I did. This is this kind of thing that we can be very, very helpful, right? It's breaking down our social norms in a way that means something helpful for us. By the way, my treatment plan just was like the worst. I was like trying to teach them how to like touch a girl on the shoulder when you're talking to someone you like. I was like, I don't know. Like, it was not a very good treatment plan. I would not recommend doing it. I wanted to show you what a non-example was, okay? So here's what not to do. So Bobby should use his napkin to clean his face and hands so the teacher doesn't have to tell him to do it later. We should listen to the rules and be good in line. Finally, to make friends, you need to talk to people. Therefore, go up to people and make friends. Why is that not so helpful? It's what? A preachy, okay. Yeah, so what we should do, yeah. Directions of what you should do, yeah. Why you should do it. Yeah, you have another idea? Yeah.
It's written in the third person, so it's not.
Yeah, so it's not like I should do this or first person. Yeah. So, and there's no picture either, right? Do you have an idea about the, yeah?
There's too much, like too many different.
Too much, right? This is what I'm saying, simple is good. Simple is good. It does not have to be complex. In fact, it's easier to teach when I can teach something very specific. That's why flirting was so hard, right? It's too complex to teach. I had to break it down. It's just, and so you need to make sure that it's easily accessible. So on that note, what I'd like you to do, we're going to do some practice here. On your, I think it's page 5, the last page. Oh, thank you, yep, page 5. The first one is a little vignette. What I'd like you to do is work with your team, your partner, you can work alone, it's totally up to you. And I want you to try writing one. Try your best. And then share with your partner just to kind of see how you compare. And if you struggle, raise your hand and I'll come walk by, okay? Okay. Would someone be willing to share their social narrative? A little vulnerability. Yeah, thank you for volunteering.
At school, we do different activities in different places. My teacher might ask me to stop doing an activity to do something different. I can calmly stop what I'm doing when my teacher asks me to. It helps my friend and teacher when I calmly change to a different activity.
Thoughts about that one? Oh, I got some bravos. That's another example. No one wants to go after you. Yeah, thank you.
In class, when the teacher is reading a story, I sit and listen. I listen so I can hear each part of the story. I am careful not to interrupt the teacher by talking about the story. If I have a comment or question, I will raise my hand and wait for the teacher to call on me. Everyone likes when I raise my hand.
Wow, that deserves round 2. Very nice, very nice. Impressive work. Good, so what I liked about theirs was that it was very short, right, and very specific. And there were two different ones, right, and with the same context. So it doesn't have to be identical, it depends on the kid. And I also like that it was enough perspective to directives too. It wasn't just, you should do this, you should do this, you should do this, right? It was why? Why should we do this? That was really helpful. So I thought it would be helpful to know what social narrative might look like, right? He's the one who's tantruming. We're working on his behavior. I might say, and this is not perfect, but we can try. In math class, my classmates and I are learning. We learn best when the room is quiet and we can focus on our work. We have quiet mouths and keep our hands, feet, objects to ourselves. If I become frustrated in math class, I can ask my teacher to take a break for 2 minutes. Classmates like to learn in a quiet and safe classroom. So what am I teaching him? A, that it's okay to be frustrated, right? We know math is frustrating for a lot of kids. We don't know why tantruming is probably not the best option, because we like to learn in a safe and quiet room. We're also giving him expectations for behaviors we want to see. So, where I brought in my favorite tickets, dollar store, $1 for a huge thing of tickets. Every time that he has a quiet mouth and keeps his hands in objects himself, I want the teacher to give him a ticket, right? That even when it becomes demanding. In fact, I want to give more tickets when that worksheet comes out during independent seat work in math class. I want him to be so rewarded for being able to keep his hands and body safe that I want him to learn that's what you expect. But I also want to give an option, because we are human, and these kids are human, that when you're frustrated, it's also okay to ask for a break. But what can happen? Abuses the break, right? So this is the one thing that the teacher's always like, well, if I give him a break, I should give everyone a break. Or if I give him tickets, I should give everyone tickets. That's usually the, right? So I'll talk about how I handle that in a little bit. But let's focus on the escape of the 2 breaks, right? Or the 2-minute break. So now I'm rewarding escape, potentially, right? So now I'm just reinforcing the escape, and I could just backfire completely. So I have to be very careful. When I develop my intervention plan, I have to be very specific to Noah what 2 minutes means. I might use a visual timer. I love the free visual timers on my iPhone. I hope everyone has it. You should have it on your phone. Because you whip it out and you say, all right, 2 minutes, and your visual timer pops up on your app, 2 minutes. But you're also teaching him what to do after the 2 minutes. And what happens, he must be rewarded. Something good has to happen when he returns. So that could be something that's highly desirable for him. So if he's a World War II fanatic, it might be he gets to work on his math while also being able to color a World War II map right afterwards. Or he gets to say to the whole class a story about World War II. Or he gets time talking about World War II with you, with the teacher in the classroom during math class. Something highly rewarding. The expectation is that over time, those rewards can be decreased, right? So let's address the comment that I get from a lot of teachers. So teachers don't like behavior reinforcement. Oh, that's not true. Some teachers don't like positive behavior reinforcement systems because they think it's unfair. Or they're worried about external motivation, right? Like, well, I want them to love to learn. And I'm like, would you come to your class every day if you weren't paid? Yeah. I love my job, but I would not be a professor if I wasn't paid. And frankly, University of Montana doesn't pay very well. And I still come, but at least I'm paid, right? We are reinforced every day. I also come to work because I love working with my colleagues. I love my students. That is also internally motivating. But if I wasn't paid, I would get another job. I wouldn't be there. So there is something externally motivated in our lives all the time. Also lovely when your partner doesn't put the dishes away and you start hassling him or her and you get annoyed. But if you say, oh honey, you put the dishes away, so, oh, hug, kiss. Oh, you put the dishes away, oh, hug, kiss. Those are external motivators. They're gonna put the dishes away a lot more, even if they don't realize it. So to the teachers, and these are exactly what I say to the teachers. Okay, what I'm describing to you is like, I get it. We want them to do but they have to learn to do it first. And aren't you frustrated? Aren't you coming to me because you need help? Let's try this. The problem is it has to be consistent, and that's a whole other workshop about that. But I just want to say there is ways that we can work with the system, and because if you have MBI school, that is a positive behavior intervention support system. It is inherently part of the school. So you're already doing it. You have bucks. Use the bucks, whatever bucks you're using, or I don't know, whatever you call it in your school, use those. That's already part of the system. Okay. Does that make sense? Questions before we move on? Okay. Okay, so I want to talk about video modeling. And that's the second kind of major skill, and then we're going to put them together. And then I want to make sure the last 20 to 30 minutes is for troubleshooting and consultation purposes. So what I love, in addition to social narratives, is video modeling. And it's amazing because the research support is really, really strong. It's shown all sorts of improvement of skills, including social initiation, conversational skills, appropriate nonverbal communication, answering informational questions, lots of ways that we can use video modeling depending on the purpose. I also use video modeling when I'm trying to teach safe hands or keeping your objects in hands to yourself. So I'm going to talk to you a little bit about developing them. And I have some examples that I hope will clarify that too. So there's kind of 4 major types. There's basic video modeling, video self-modeling, point of view video modeling, and video prompting. And they all have different purposes and different ways of using it. There's advantages and disadvantages depending on what you need them for. So with basic, we're talking about recording someone beside the learner. So not the learner, the student themselves, but someone else. And it shows the model engaging in the target behavior or skills. So here's an example. And I won't show this whole thing because it is quite long, and you'll get the point pretty quickly. All right, I'll pause it right there because it keeps going for a while. And that's my colleague, Jennifer Schofield-Clausen, who's a speech and language pathologist at UM. And clearly, she's teaching someone to make tea. What do you notice about this basic video model?
No words.
No words. Really simple. Going through the actions. What would be an advantage of this approach? Nonverbal. Yeah.
I think pictures speak louder than words, and you only engage one part of the brain to concentrate. You're teaching the task, not the communication.
Yeah, so you're just focusing on the action. Yes. Yes. And you can pause it. Isn't that lovely? Technology, it's so great. You can pause it. And so guess what? If there's a kid who's learning, let's say in the life skills classroom, and they're learning how to make tea, you can pause and follow along and go with it. And frankly, like we kind of do that in YouTube anyway. Like my husband wants to build shelves or something or stairs, and he'll watch the YouTube, press pause, do it, and go back and watch it. Right? This is what we do on a normal basis. So it's useful for that. Are there any instances where you can see this being helpful for your students, your clients? Maybe a particular skill that you're trying to teach them? Yeah, you go ahead.
One of the kids gets really boundaries coming up. We were trying to
Boundaries. Mm-hmm.
So teaching them, showing more what's acceptable.
Yeah. Yep. Absolutely. Any others? Yeah.
Maybe a kiddo struggling with transitions, showing them what that can look like.
Ah, I have a great example for you too. Yeah.
It's a good transfer of stimuli from the person to the video. So sometimes going from a live to something pre-recorded, it's an easier transition.
Sure.
Or for some who are more technologically savvy or in the like, it now puts that right in their wheelhouse.
Yeah, totally. And sometimes they have their own iPads, you know, because they have their like PEC system or any kind of picture communication system. They'll be better at video editing than I ever would. So let's move on to the next one, which is video self-modeling. In this one, the video is the subject and you video the subject, the student, and edit out the less desirable behaviors, so the model is only the desired behaviors. You have the subject imitate a behavior or task you just demonstrated. So you demonstrate the task, you have them practice it once, you film it, and then you edit out all the things that you didn't want to see, and just have that. It's motivating because they're watching themselves. So here's an example.
Hello, Caitlin. This is Brandon. I was wondering if you want to go to Spy Volcano. First ask the kids. He said yes. Awesome. I'll see you at 3 p.m. on Saturday. Well, bye, Caitlin.
So that was a really simple one. So making plans, like teaching a student, like how do you make a plan with a friend. But there are other ways, of course, you can use video self-modeling. Any ideas that you would use video self-modeling? Yeah. How to get into line? Yes, absolutely.
How to ask for help.
How to ask for help? Good. Yeah.
I just have a quick question.
Yeah, sure.
When you ever show videos that are like, this is what's not expected, or
Yeah.
to like show
So-
like inappropriate behavior, so maybe like a silly video, and you tell me what's wrong with this video, or like.
Yeah, that is a really good question. So the research is kind of,
Yeah, I heard both.
yeah, it's not so clear. So what we do, and like in our camp, we have them model it and discuss it, but the video is only the appropriate. So, because part of it's teaching, and it is, the non-examples are important. The trouble with video is that it's permanent, and I don't want them to accidentally play the not appropriate one, because the idea is that they would take it home with them, right? That they would have that easily accessible whenever they wanted to. So that's kind of my call. You could argue it, because research isn't clear there. Yeah. So go through the other two, and then we'll have a practice opportunity. So here's the point of view. So this gives the perspective through their eyes, so they can take the position of the participant. So
I pet the dog. I use soft touch. Monkey, come here.
that's also Jennifer's dogs. That one passed away just like a month ago. You're old. So really helpful. And so by the way, petting the dog is actually really, really helpful for those of you who actually have pets, because how many times a kid's like slapping at the kid, at the dog, and the dog's patient enough. But what I find helpful for these, just these are for the adolescents that I work with, the kids with autism who are like, wearing ties. When you learn to tie a tie, you're learning from the other person's perspective, not from yours. So this way you can have the video here and know where to tie the tie and follow the instructions from the perspective of the person who's putting on the tie. Tying the shoe for the younger kids. Also, another way, everyone teaches you from the other person, but you're looking down. So you can videotape looking down that way, which is helpful too. Yeah?
I've read some things about kids with autism and having perspective in the pictures always being what they would see versus of them. What do you think about that?
Yeah, so video modeling, like even when it's a peer model or peer-mediated instruction is really effective. Having models are effective. So right now it shows that it's pretty effective even to have like a peer. And I think it depends. Like if you think this kid is not going to get it with himself or get it with a peer, have himself, you can try both. That's the nice thing about these. These are short. So, all right. And then video prompting is the last one. And this is establishing routines, kind of similar to the basic video model we just saw. But you may be more effective than basic video modeling because you pair it with a visual support. And you use a task chart. And you might break a task into steps. So if there's a task like going to the bathroom, which is lots of different tasks, right? You walk into the bathroom, you go to the toilet, you either sit or stand depending on your needs, pull down the pants, you do your business. I mean, there's just all these tasks, right? And then we actually have videotaped the whole process from start to finish for this reason. And so it does allow for visual supports, and then you can add the visual support next to the toilet as well to handle toileting issues too. And so this one's another long one, so I'll just play that for
Okay, so
a
when
little
you
bit.
do your box tops, you need to get all your box tops, tape, scissors, and your box top sheet. Press pause on the video while you get your materials together. Once you get your materials together, you can cut out each of your box tops. Pause the video while you cut out your box tops.
Okay, for time purposes, I'm going to pause there because I think you got the point. So again, you're just breaking down a task. It could be all sorts of different tasks. It could be behaviors that you want to see, like standing in line. Remember, that's a lot of different tasks. I mean, clearly there's a lot of YouTube videos who use this process too, so it's not entirely novel, but it is very helpful. But it has to be short, and not, and don't include music. Don't include fancy letters that go across. Be like, hey, we're learning social skills today, and there's blaring music. I have a non-example that my graduate student allows me to show because it's her first one that she did. And it was really cool because it has music, and she's like, and then she's now third year doc student. She's like, oh, Anissa, that was so bad. And I'm like, can I show it? She's like, yes, so people don't do what I did. But essentially, she includes music and makes it really engaging. And again, simple is good, short is good. No music, no editing, except for editing out the disruptive, inappropriate behaviors. Okay, so this is where I was supposed to show that, but I don't have time, so she'll be really, really glad. So what I like to do is, since there's running out of, and I do want to make sure we troubleshoot and have some consultation time, what I'd like to do is maybe jump to combining the two together. Because you'll practice with the video model, with some of you with phones, you can practice it right now. And we'll spend about 10 minutes on that, and then we'll jump into troubleshooting. But here's an example of personal space. So we teach the kids in Yeti that with non-family members, they can give a high five. So there's a social narrative in addition to the video.
Dave and Grady don't know each other that well, so instead of doing a side hug, they're going to do a high five or pound. That's a much better touch for someone you don't know very well.
Now here's another example. Here's the locker room rules.
I keep my hands to myself, and I don't use phones and cameras in the locker room.
So that's Jen's son, who's now 13. He's always our model. He's our peer model. So we're teaching them locker room behavior, and there's actually multiple locker room things, did you know you're not supposed to choose the locker that's right beside the person who's already there? You're supposed to, go several lockers down. There's all these kind of, again, social cues, and these video models can be really helpful. So just to make sure that we have some practice time, use that on the page 5, there's a couple, there's a video model one, and then there's this one that you can combine. You can choose either one that you want. Go ahead and practice, use your phone. If you don't really want to do that, that's totally fine. But try practicing it because it's actually harder than it looks. Think about a social narrative. You can use the one that you did already. And then actually have an actor go through that process. You can use this space, you can use the hallway, you can use this corner, wherever you need to go. And I'll give, let's give about 7 minutes, and then we'll kind of process. I'm loving some of these ideas. I thought it would be helpful to share maybe one social narrative with a video model that I created. I might have to do my clapping. There we go. Good. I was going to threaten the clap that I always do with the kids. So I want to show you just a little bit, and then we're going to jump into some troubleshooting consultation. So this is a finishing snack and going to circle. When I am done with snack, I put my dishes in the sink, I put my napkin in the garbage, and then I go to circle. So that's the social narrative that you can just include. Or you can include that with the video model itself.
Where's my snack? Dishes are in the sink.
He's a great actor. So I think what I really wanted to highlight is that you can integrate multiple evidence-based practices together to really be extra effective. You can also choose one versus another. It depends on the issue and the concern. With NOAA, what I would do is probably a social narrative and a video model. I would do a social narrative that we included earlier, right, with that keeping hands, feet, objects, themselves in math. And then I would have a video model, and I'd likely try to have him do it because he's 11 and relatively functioning in a way that I think could probably handle going through a video. And then I would play that video in the beginning, in the morning, prior to math class every day for several weeks. And that would hopefully improve the likelihood of him learning what the expected behaviors are. The last part of the process, the problem-solving process, is evaluating the intervention. I can't get into it too much detail, but I will say the database decision-making is the most important thing we can do as therapists. We have to know that what we're doing is working. And no matter, you can have the perfect intervention and it won't work for that kid, right? But how do we know it's not working for that kid? And the way I talk to my students is like, feelings-based decisions, the only time to do that is when you're trying to get a job. Like gut feeling, that's the time to get it. That's when you trust your gut and go for it. Otherwise, database decision making is really, really critical. And so you collect data, and skimming through this part of hopefully counting the number of tantrums, which is actually quite easy compared to some other ways to collect data. Hopefully seeing a decrease in Noah's tantrums. So hopefully we know that intervention is working. But what if it doesn't? Like everything that we just did didn't work? We start right from the beginning. Start from identifying the problem. Did you identify it correctly? Did you analyze it well? Do you need to analyze it more? And you start the whole process over. And it might take time, but that's why the problem-solving model is so important. So just some takeaways. Prevention is the best medicine. Can't tell you enough. That's why the problem-solving model is really helpful, because we can evaluate an intervention only when we know that the intervention that we've done is potentially going to be effective in the first place. Intervention should be individualized. So the reason why I like social narratives and video modeling, there's tons out there in the internet world, but that's not specific to their needs. That's not them, that's not their peers. Individualized social narrative is more effective than just a generic one that you take from a book. And evidence-based interventions such as social narratives are just helpful in teaching students positive behavior and using the positive behavior intervention supports that are already in the school, already the language is there, and using that to your advantage. And then, of course, database decisions. So I promised I would spend the last 20 minutes doing some troubleshooting, because I know it's easy for me to teach all this stuff and be like, yeah, but what do I do with this kid, right? And so I thought what I would do is really briefly do the what do I do when questions and preemptively. Because I know personally, I do this too, because it's like, well, what happens if? So what do I do when Noah's tantruming and the teacher calls me into the classroom to help? Like, I'm in that crisis. I'm in that moment, right? And remember, everything I've taught you today is prevention, because you can do anything to try to address a crisis, but in the long term, that's not effective. That's not a useful time or useful way to use your time. Your time should be on developing the intervention to reduce that from happening in the first place. If it's tantruming, it's too late. But what do we do with? Okay? Well, it's not easy. Unless you're man trained, really you shouldn't be holding or grabbing the kid in any way. You want to keep the body safe, right? So it might require removing kids out of the classroom. It might remove him out of the classroom. But ideally, you're not doing so by grabbing him, touching him, because frankly, when that happens, you get hit anyway, and it's not helpful. But structured ignoring and differential reinforcement are really helpful. So you can, if it's escape behavior, you really can't allow him to leave, right? Because that'll just reinforce it. But you can do some structured ignoring. And structured ignoring, and I use structured because you're not just ignoring the behavior, especially if it's self-injurious, you definitely want to step in. But if it's just tantruming and throwing stuff, it might break a few things, but you might have to just ignore. Or you can provide differential reinforcement. Both of these, by the way, I think are on that National Professional Development website. The best strategy is possible to completely ignore the behavior, especially if it's attention seeking. In Noah's case, it's escape. So it's hard to say. It could be also attention, but hopefully keeping him safe as possible. Ideally, again, preventing it from happening. Do not try to reason with a student. There's no point in that moment to even try talking. It's just it's not gonna, you can't coax and figure out what the error in the student's ways. You're not gonna teach them the student good behavior. You're not teaching them anything when they're in that kind of dysregulated state. So give the child what he or she wants. If it's a preferred food or mealtime, do not, because that'll just reinforce whatever behaviors you're trying to reduce, right? And then allow the escape or avoid what he or she does not want. So if you know the function of the behavior, then you now know what to not reinforce. So if it's escape, don't let him escape. If it's attention, don't give him attention. Because again, he'll learn that tantruming gets what he wants. Okay, so another what to do. But what do I do when Noah says something socially inappropriate in class to his peers? That's a common one. Like really like a dirty joke or a sex joke or something totally like not cool in a school setting. What do you do then? Here's some ideas. You reinforce appropriate behaviors. You want to use specific praise. So Noah, you complimented Peter on his video game. Compliment show you're a friend to Peter. Noah, way to go. You let Sarah talk about what she wants to talk about. If you have a reinforcement system already in place, use your ticket system to reinforce that appropriate behavior. Again, teaching what he should be doing, not only in what he should not be doing. And then immediately, like if you hear it, and especially if it's like a super inappropriate joke and you're just like, I have to say something. You may choose to structure ignoring, you can. Or within 2 minutes, bring Noah aside and say, Noah, I noticed you were talking about things having to do with the bathroom. That topic is private. Friends like it when we keep bathroom talk private. So I'm almost doing like a little mini social narrative. And guess what I'm going to do next time I have a session with him? I'm going to do a whole social narrative about bathroom talk, right? I'm going to talk about why that's not appropriate. I might also say, no, I noticed you talked at the same time Peter talked. He looked upset. We take turns when we talk, so everyone has a chance to say something. Again, bringing in a little mini social narrative. Okay, so I wanted to open it up for your clients, things that you're struggling with, clients that you've experienced, like what should you do? And I'm happy to provide ideas. Yeah, go ahead.
I feel like with the students that I work with, a lot of like high functioning is the escape is often their motivation, and finding a replacement behavior for that is tough in the schools.
Yeah. Yeah, so kind of the general thing is, for a lot of these kids, escape from unpleasant activities, which is frankly also common with typical kids because they don't want to be in school and doing not fun things. So the replacement behaviors. So I love that you're thinking about replacement behavior. And what I would suggest is doing a really good functional behavior assessment, finding out what particular tasks or activities he's particularly escaping, and then give him a reward for doing that task immediately after. So let's say I don't know, do you have an example? Like of an activity or task they hate?
I have a bunch of examples, but let's say social studies.
Social studies. So doesn't like socials, doesn't like the teacher, wants to get out of it, will do anything in their power to leave. So let's say you do incrementally, let's say social studies is a 45-minute subject. You give him 10-minute increments. If he stays in for 10 minutes, he'll get some kind of reward. So 10 minutes in the classroom means that he'll get whatever his favorite thing is. It could be a ticket system that he gets something really big, but hopefully something immediate, something he absolutely loves, the thing that they love. Oftentimes it's their preferred topic or their restricted interest. Then 10 minutes after that, do another 10 minutes after that, and he'll add up. Then you start increasing it from 10 minutes to 15, or 10 to 12, depending on how tough it is, and depending on the age. And then you incrementally improve, but he has to get the reinforcement for staying in there, because Otherwise, yeah, you just got to keep doing. You can't let them escape. Does that seem possible? It is very hard. And you need the teacher involved. Yeah, and you need the teacher, yeah. For a little bit, and then yeah. So one of my favorite things to do is make a menu and have a treasure chest. Put all the things in the menu in the treasure chest, and he doesn't know what it's going to come out. So there's a little bit element of surprise. The treasure box system, they don't know what the reinforcement is, and so there's a little bit of anticipation, changing it up. So and it could be everything from time on the computer, iPad time. It doesn't have to be tangibles, but it could include tangibles too. So that's just something I found helpful when their incentives, like one day they love this thing and then the other day they love this thing, and you're like, I just need a reinforcement system. Just put them all together, make a whole menu, and they can choose. InterventionCentral.com also has a great menu selection process. That's what I use sometimes just to kind of collect ideas, because sometimes I'm like, I can't even think of ideas for them to give. Intervention Central. InterventionCentral. I think it's .com. Is it? Oh, it's in. Oh, good. It's in the resource. I did put that in there. Good. It's one of my favorites. It's my go-to. Yes.
My question is, maybe twofold. Do you have a lot of experience working with teachers, and so resistant teachers? Some teachers who are resistant to using a positive reinforcement system, even though a school is MBI.
Yeah, and then they don't like MBI either.
Yeah, I guess what's worked for you to get teachers on board with implementing some sort of system that might actually work for?
So the way I frame it is, if they're coming to me for help, it means it's gotten bad, right? So I usually sit down with them and hear out. So what are they concerned about? So they're usually concerned about internal motivation versus external. That's one of the things that they have problems with. Like, I want kids to love to learn because they love to learn, not because I'm making them. So hearing them and listening to them and really respecting their perspective and say, yeah, I get it. I absolutely. And then doing a little bit of psychoeducation, right? So kids with autism, just the way I kind of talked about space, I use the space one, I talk about flirting, something that they can relate to. It's like, well, imagine someone having to teach you how to flirt. So, that's a really hard thing to teach, or teach you where to, stand. So something that we found helpful, and I say things like, other teachers have told me that this is helpful. And I'm not lying, because they have, right? But that can be also helpful. Worst case scenario, I've gone to the principal and administration. And especially if it's tantrums, like the principal wants something done, right? So you might need a little bit of pressure. I try not to do that. It's like a last resort situation, because it can rupture rapport with your teacher, all sorts of things. But it's usually because of lack of education or understanding of what reinforcement is. They think it's like bribing. Right? And you might want to teach the difference between positive reinforcement and bribing. Bribing says, if you do this, I'll give you this, right? That is different than saying, I expect you to do this. Here are the rewards that you can get. It's framing it different, but it's different than bribing. Bribing is not effective. Positive reinforcement is. So some of that might be education. Listening to them, sometimes I just listen to them. Like, that can just be helpful, and if they're referring this kid to you, they're frustrated, and hear them and have them cry, have them vent. And then once they kind of gone out that, say, well, let's think about some solutions. Let's come together. And I try to create a team, a collaborative team. Getting others like school psychs. So I train school psychs. So all school psychs know FBA and positive reinforcement. Like, they're the ones who are like rah, rah, rah the most. So if you can get them on board, if you have that one teacher who loves it too, have them come to the staff meeting and highlight what they do. Right? So like, hey, Mrs. Smith, you really worked with Bobby on his tantrums, and I really worked with, do you mind sharing with your teachers, like, and staff, just highlighting kind of what you did, maybe telling the challenges, but also the things that worked well, especially if it's there's always a hierarchy of teachers, like who gets the most power. So find out who that power is, where that is, and say, I'd love to get your support. I'm really trying to advocate for kids, and so they can learn in your classroom. Is there a way that you can share your story? And so it's a lot more powerful when it comes from a teacher than it comes from a mental health provider. Does that give some ideas? It's a struggle. Yeah, I've experienced, when I was a school psych, it was a constant struggle. Yes?
High school kids are ideally. We've had some kids that, have been homeschooled and have
some, spectrum stuff going on, and then they come in and you have to do these systems. Oftentimes, if you have a real intelligent kid who's not in a bunch of special ed kind of classes, you have a really hard time having teachers, also a period of teachers follow really any plan.
Oh, so adherence to a behavior plan or something?
Yeah, so if you come up with a behavior plan, or even just a plan on how to deal with any behaviors in the classroom, 50% of the teachers don't follow it. What do you think it's useful even if a few of the teachers are following it? I mean, I think we have never had a full 7-period block of teachers follow a plan.
I love positive reinforcement of teachers too. I've done that before. So think about it. I have 20 kids. One kid is really difficult, but I have 20 other kids who also have really difficult. So from their perspective, it's really hard to maintain a behavior plan when it's just for one kid, right? It's hard to remember, it's hard to think about it. I just can't remember anything. So I always choose behavior interventions that are going to be the easiest to implement. So for example, if I want them to take data, which is always difficult, as a school psych, I want them to take data. I'm like, come on, I need data. I do things like have paper clips in their pocket. And every time the tantrum happens, they move the paper clip from one pocket to another pocket. Like easy, they don't have to think about it, they don't have to write things down. I make it as simple as possible. So sometimes that can help. I wasn't joking about the positive reinforcement. So I have so when using a great example of a teacher who's implementing something really great, I throw the praise. I'm just like, oh my gosh, did you see how Billy changed from da-da-da to da-da-da, like overnight? I really could tell that you were implementing the behavior plan because you were doing X, Y, and Z and being very specific. And then in a staff meeting or any kind of group setting, I say, gosh, you should see Mrs. Smith because what she was doing is awesome. And then I list very specifically the praise of what behaviors I want to see. Like she implemented, she noticed that every time he raised his hand, she called on him and praised him with very specific praise. And so trying to highlight, again, reframing it to the positive, because teachers do not get enough positive praise in their lives. And anytime I do an observation in their classroom, I send an email with a thank you, because it's like they are not paid enough, they're doing amazing work. And I have to respect that their work is making it difficult for me to do my work. But what can I do to make them feel that they can be a part of a team and praise them for the things that they are doing well, even if it's just out of the whole behavior plan, they read it. That's a huge thing, right? That they actually know it exists, frankly, sometimes is a big deal. So even saying, I so appreciate that you read that over. That really makes me feel that you're really paying attention. I think that's really awesome. What can I do to help to make it easier for you? And they'll be like, well, I just can't take the data. Or it's really hard for me to praise him when I can't praise the others. Oh, praise the others. Praise the others. Please, please, please praise the others. Whatever it is that the obstacle's in their way, give them strategies to show that they can do it. That's the big picture thing. Each instance is different, of course, and each teacher sometimes, and I've had a teacher who says, no, not doing it. And I'll be like, okay. What? And then at that point, usually that's not the first instance this has happened, and then I sometimes have to talk to administration, because it's like, I can't do my job, right? I can't help you, help me help you, Yeah.
I was wondering if you have a really simple, easy way that you gather data in your clinic, and then how you track that and measure fidelity, if you could send that along as well.
Sure.
I think that's what we're all there's so many forums out there.
There's so many. Honestly, scratch paper, lines. That's what I do in my private practice. It depends on what I'm measuring, right? So it's a frequency count of number of 20-minute increments, every 30 seconds does it occur. So I have lots of forms. I think it's best if I know the behavior you're going to measure to then know. Tantrums is really nice because it's kind of obvious. You're like, yep, that happened, check, right?
I like your form you had that just had that red line. It was like,
oh, the it went down, yep. Wouldn't it be lovely if it happened every time like that and so beautifully? I'm sure every client of mine looks like that. That's totally made up data. But yeah, the data is really nice because then we can make decisions off it, right? And we can know. And honestly, okay, can I just say, as mental health practitioners too, you don't get enough praise either, right? We don't get enough reward. How do I know I'm doing a good job? My supervisor can say that and they're like, well, you're not in session with me, or maybe you've watched a couple of videos, but how do you know I'm really, man, if I can see a graph like that, I'd be like, going out for some wine. I am like, you know, yes, I did my job. Isn't that an amazing feeling? So to me, data is not just about like, do I know if I'm, you know, if it's working, which is clearly important, but it's also for me. Like, I want to know, like, am I just putting all this work for nothing? I feel like it's working. My teachers say it's working, but then all of a sudden it'll go downhill again. But maybe over time it's working. And data, to me, that's where I can like, whew, I've done my job. So that's why I love data so much too, because man, I don't get enough rewards in my life. Yeah.
I'm curious to hear your perspective and maybe suggestions on a client that we have. He's a 9-year-old boy on the autism spectrum. He doesn't have a lot of peer social skills. He seeks adults for relationships. And last year, one of the things that he did, he was really into these chapter books in 3rd grade. And he started sort of adopting the persona of one of the characters and talking in a certain voice, and then assigning names to the teacher and the pairs in his extended resource class. And while I think it can be positive in some ways, it became sort of this whole thing in the classroom where he was Benjamin Stilton and the teacher was so-and-so.
Right.
And it became less about social skills and
yeah, that's a tough one. And for those of you who are like, oh, but it's time. This will be the last one, and then you guys can go, and then I can just hang out. So this kid is kind of taking his chapter books and making like people in his lives characters from the book. First of all, great symbolic play, awesome. Think of the strengths-based here. But yeah, in terms of social, so one of the things you could think about is the social narrative of when you're allowed to do that and when you're not. So you can do that maybe with his family. Maybe that's a reward. So that could be his reward for doing something socially appropriate, is you get to spend time with a teacher making up this world of the characters. Maybe it includes a video model of what that looks like. Rewarding him, if that's really something rewarding for him, use that as like the reinforcer for something that you are trying to teach him otherwise. That would be the quick and dirty of like what I would recommend without knowing more.
what about language to explain that to the teaching team so that it doesn't, because I sort of feel like the bad guy coming in and being like, well, I don't think we should.
So the teacher supports that? Oh, okay. So you can say, so one of his goals is learning socially appropriate behaviors. And so think about if he kept learning this into middle school or high school. That will lead to some really difficult peer relationships. And also he's probably not learning the academics that he probably should be learning. So I always bring it back to learning because that's what teachers want, right? So let me help you. So you can say, well, if you really, this is great, because if the teacher values it, say, okay, how about we give incremental times in which he's allowed to do that and times he's not allowed to do that. So he learns math. If I don't know, if he has trouble with social, maybe in recess, something he has difficult with social cues or something, reward that with time with the teacher playing this character game. Yeah, that would be the best. Okay. Okay. It's right on time. First, I just want to say thank you for everybody for coming and inviting me to be part of this workshop. It's always fun to talk with mental health practitioners and not just my students. I am available for consultation, ad hoc consultation. You can always email me with questions as well. I check my email pretty rigorously, probably too much. After November 1st, I will not, because I will have an infant and I don't know how my life will change, probably a lot. So before November 1st or after February 15th, I will be checking email rigorously. This is my email. That's the one I prefer, like if it's just like general questions. If you actually have a client and you're interested in getting a psych eval, I do most of my private practice is psych evals. And you need a referral and all that, that's my private practice contact information. They are two separate things. I stopped seeing clients even. I'm wrapping up my final client before maternity leave, but I should be seeing probably late spring. I'll probably start seeing clients again.
Medicaid?
I do take Medicaid. And I actually take more Medicaid than other psychologists because I also have a full-time job, and I recognize the lack of psych eval, or psychologists who do psych evals for children in particular. And my age is 3 to 21. I do see over 21 if it's ADHD and learning disability referrals for adults. So, but typically, I get a lot of the early kiddos. So, all right. Well, thank you. I'll be up here. Appreciate it.